Okay, magandang hapon po sa ating lahat. Muli po ay pagpapatuloy natin ang pag-discuss po ng tungkol sa Qi, types of Qi. So yung gathering Qi po, yung Zong Qi. So ito yung Qi from the chest, o chest Qi, Xiong Qi, big Qi or yung Da Qi. Da Qi po yung galing sa hangin. Big Qi of chest. So, mula po ito sa interaction of food chi with air. Pag kumain tayo, pumunta sa spleen, yun yung napoproduce ay food chi. Tapos, kasama yung air na from the lungs, yung spleen send food chi up to lungs, we're combining with air. So, matatransform po ito sa gathering chi. Ito po ay more subtle and refined form of chi than food chi, usable by the body. So yung gathering Qi or yung Zong Qi, ang gawain po nito ay nourishes heart and lungs, enhances and promotes the lungs function of controlling Qi and respiration, and the heart function of governing blood and the blood vessels. Ito rin po yung nag-control sa speech and the strength of voice, affects and promote blood circulation to extremities. Kasi yung lungs and heart po yan sila yung namamahala. So, closely related to lungs and heart functions. So, yung lungs po, siya yung nag-assist at controlling chi and breathing sa paghinga natin, namamahala lungs. At ang heart naman, controlling blood in the blood vessel. Yung heart po yung charge sa moving ng blood sa ating blood vessel. So, kung hindi nagagampanan ng heart yung kanyang role, ang nakikita po natin sa pasyente ay yung mga mapuputla. Makikita natin yung face maputla, yung pulse mabagal, yung tongue maputla kasi yung blood sa blood vessel ay konti. Pag may problema yung heart. So itong gathering Qi po, siya rin yung nag-assist sa heart and lungs to push Qi and blood to limbs para pumunta sa mga kamay natin, especially to hands. If gathering Qi does not descend, the blood will stagnate in vessels. Kaya yun, makakaramdam tayo ng mga pananakit. Yung pagbubukol-bukol pag nag-stagnate na sa ating mga vessels. So magkakaroon din po tayo ng malamig na mga limbs, especially sa hand. So ibig sabihin nito ay yung ating gathering Qi ay weak. Also gathers in throat, influences speech, under control of heart, and strength of voice, under control of lungs. Yan. So, pag mabagal yung ating salita at mahina, affected ay ang heart and lungs. Speech impediment, very weak and fine voice. So, ibig sabihin nun, weak yung ating gathering Qi. The state of gathering Qi gauges from health of heart and lungs and from circulation and voice. So pag may problema yung hina ng ating boses, tapos yung pagsasalita natin, yung pag-uutal-utal, ang may problema po ay ang heart and lungs Qi. Itong gathering Qi. Weak voice and poor circulation to hands, weakness to gather Qi. So being energy of chest, affected by emotional problem, grief and sadness, pag sobra tayong nalulungkot, magpapahina sa ating baga, ang gawain na mag-disperse ng energy sa chest ay hindi po niya magagampanan, kaya pwedeng magkaroon ng pananakit ng dibdib. Both front position of left and right, heart and lungs, of pulse are very weak or empty. Pag kinapa po natin yung pulse, halos di natin maramdaman or napakahina. Gathering Qi and original Qi assist each other. Yung gathering Qi mula nga dun sa food, sa wind, tapos yung ating mga kinain, yan po nagtutulungan upang maging Qi. Gathering Qi flows downward to aid kidney. Original Qi flows upward to aid breathing. Mutual assistance between lungs and kidney. Clinical note, to tonify gathering Qi or Zong Qi, gamitin po natin ang REN 17 or SEBI 17, Sanjung, and Lang 9, Taiwan. So, pinapalakas po natin yung lungs and heart. So, ayan po yung ating illustration. Makikita natin nasa inyong REN 17. 1, 2, 3, 4. Pag kinaba po natin yung ribs, nasa katapat siya ng 4, pang 4 na ribs. Okay. Yung langnay naman po, ayun, sa ano ng thumb natin, nasa baba. 1 tune. Lateral radial arteries. Chest area, okay, Doc. Chest area where gathering chi collect is called Sea of Chi. Tawag po doon ay Sea of Chi. Controlling point for Sea of Chi and gathering chi is REN 17. Napakalaga po ang REN 17, siya po yung Sea of Chi. Gathering chi also treated by heart and lungs. So pag inacupuncture po natin dyan, ang ginagamot na natin ay ang heart and lungs channels. And by breathing exercise. So kailangan may breathing exercise. Gathering chi, it nourishes heart and lungs. It enhances and promotes the lung function of controlling chi and respiration, and the heart function of governing blood and blood vessels. So it controls the speech and the strength of voice. It affects and promotes blood circulation through two extremities. It is coordinated with original chi to regulate breathing. Thank you po.
Thank you very much, Ma'am Mildred. So tuloy na po tayo. We proceed to tongue diagnosis. Okay, so topic is still sa red points. Continuation po ito ng topic kahapon. Ay, iba na pala. Okay. Red tongue pala kahapon. So let's talk about red points. Before natin i-define yung red points, we should define the red grains, no? So yung physiological minister fire ascending to communicate with the heart, ito po yung nagpo-form ng red grains on the surface of the tongue. And we should bear in mind that the tongue is the offshoot of the heart. Okay? Now, normal po itong red grains. These indicate that the physiological minister fire is in a healthy state. So hindi siya excessive nor deficient. When the minister fire becomes pathological from various life influences, it flares upwards. So this will cause the red grains to become redder and to protrude from the surface of the tongue. So they will become more visible. So when these red grains become visible, they are now called red points. Okay? Red points are always pathological, no? They indicate pathological state of the minister fire flaring upwards. Red points always indicate heat to a degree greater than when the tongue is just red. So kung may mga red points na po, it's a little bit more intense, no? The intensity of their color and their distribution clearly correlate with the intensity of the heat. So the more intense the color and the more dense the distribution, the stronger the heat. So kung mas marami tayong red points nakikita, mas marami pong heat. So here we have an example of the red points.
Yung prickles, Doc.
Yes. Red spots. Okay, meron tayong tinatawag na red spots. They look the same as red points, except that the red spots are larger and they are only seen sa root of the tongue. Okay? So they also indicate heat, but meron po siyang additional component ng blood stasis. So if you see red spots, nasa posterior, nasa root of the tongue po siya, and they also have blood stasis. So ang red
sa root of the tongue, Doc, yung red spot, blood stasis pa rin. Basta
yes,
red spot na malalaki po.
Yes. So red points, these are frequently seen po sa tip, sa side, center, or the root of the tongue. Okay? Tip, sides, center, or root of the tongue. Red points on the tip, napaka-common po nito. They indicate heart fire. So this is due to emotional stress. Kaya if you see your patient, may mga red spots po sa tip, advise them na wag masyadong mapadala sa emotions. This is very common po, no? That's heart fire. It doesn't mean na may problema ka na sa puso. It's just that medyo sensitive ka lang talaga sa emotional stress. So if you see red points po sa sides in the liver area, this indicate liver fire. Pag nasa center naman yung red points, stomach heat, no? So stomach heat may also be reflected in red points on the sides, pero doon lang po sa middle section of the tongue and along a broader strip. So let's take a look at the figure, no? So this is liver heat, yung nasa left, yung stomach heat naman, if you notice, nag-occupy lang po siya more on the central part, kahit sa side siya. Okay? So that's the difference between liver heat and stomach heat. So with lung heat, the red points, they appear either in the chest area, as you can see here, or nasa whole front third po siya ng tongue. Okay? Samantala, yung heart heat, nasa tip lang po siya. So if you see this on the chest area, so that's lung heat. Or it can occupy the whole front third of the tongue. So if you see red points on the root, they indicate damp heat, no? In the bladder or intestines. Now let's talk about red points in external diseases. So yung significance po ng red points in external diseases is different from that in internal diseases. No? So if you see red points in acute external diseases, ibig po sabihin may invasion of wind heat. Hindi po wind cold. Okay? Wind heat kaagad. In external diseases, the density of the red points will reflect hindi lang po yung intensity ng pathogenic factor, but its progression towards the interior. So that means there is always a possibility na magi-interior na po yung pathogenic factor. If in the course of an acute external disease, the red points become denser, so that means yung pathogenic factor naging stronger and it is now beginning to penetrate sa interior. Okay. Yung distribution po ng red points also reflects the stages of penetration ng external pathogenic factor. In the very beginning stages ng external wind invasion, yung red points are concentrated po sa front third or on the sides. So be aware, no? Okay. And these two areas, they correspond to the exterior of the body, while the center of the tongue corresponds to the interior, no? So if after a few days, the red points from these two areas extend toward the center of the tongue, it indicates that a pathogenic factor is now penetrating into the interior. Okay? So here you could see the areas corresponding sa interior and exterior in acute external diseases. Okay? Maraming salamat po. Any questions?
So, ganun pala yung doc, yung mga points na yun, ano?
Yeah.
Pagpaparami, pa-internalize na.
Opo. Lalo na pag kumakalat na.
Opo.
And pag wind heat po, usually makikita nyo yung ano.
Pag malalaki,
Oh,
stasis.
yes.
Stasis na po.
Sa
Kaya mga
likod.
key point na dapat matandaan.
Yeah, very good. Yeah. Okay, so I hope that helped, no? Marami pong ganyan, actually, yung may mga red points. Okay, let's now go to the next topic. Punta na po tayo ngayon sa feeling of cold and pakinggan natin si Ma'am Mildred ulit. Ma'am Mildred?
Yes, Doc. Feeling of cold, wind cold and wind heat. Wind cold, differentiation between attack of wind and attack of cold. So far, we have talked about wind cold in general, but the discussion of cold-induced diseases differentiate between two types of wind cold invasion, one with prevalence of wind, cold attack of wind, and the other wind prevalence of cold, cold attack of cold. The attack of wind is described in clause 2 of the discussion of cold-induced diseases. The greater yang pattern with fever, sweating, aversion to wind, and a floating and slow down falls is called attack of wind. It may seem strange that the falls is slowed down in this pattern as wind is a young pathogenic factor that moves and offends. However, it is also true that wind may cause stiffness, as in occipital stiffness in the wind-cold invasion. So pag nag-stiffness po, sign of wind. Tapos rigidity and paralysis. Thus, it is quiet, possible for the attack of wind of external wind cold to cause a slow down falls, which is less slow than the slow falls. The commentary to clause 2 confirms that U1 in this case means a moderate and slow chi. Slow po dahil cold. Yung po lagi nating tandaan dyan. Slow chi or falls. Clause 3 describes the attack of cold, the greater yang pattern with fever or no fever. Aversion to cold, body ache, retching, and tight falls on both yin and yang is called attack of cold. In attack of wind, the patient's nutritive chi is more deficient than in the attack of cold, and this causes a slight sweating. The other symptoms are tabulated in table 42.3. Apart from wind heat and wind cold, simultaneously shivers and fever. So yung po pag wind heat, may lagnat siya. And fever may also occur with invasion of summer heat, damp heat, and dry heat. So yan po. Wind cold, attack of cold, common manifestation. Siyempre, ayaw mo ng lamig. Tapos yung pulse ay floating. Ang iba pang symptoms, pronouns, ayaw mo ng lamig, aversion to cold, body ache. Wala kang pawis dahil lamig nga eh. Tapos yung pulse dyan ay floating tight. So ang treatment po natin dyan, release the exterior by causing sweating, mawang tongue. Pag wind cold, attack of wind, so ang common manifestation nito ay occipital stiffness. Ang iba pang mga symptom, syempre malalaman natin dahil ayaw natin ng hangin. Tapos may fever, slight lang, sweating, pulse, floating, and slow. Release treatment, release the exterior by adjusting the space between the skin and muscles and regulating defensive chi and nutritive chi, Wishi Tang. Pag summer heat naman, summer heat is a type of wind heat which therefore manifests with a simultaneous feeling of cold and fever. The clinical manifestation usually are fever or hot feeling of the body, shivers, the sweating, headache, a feeling of heaviness, and an uncomfortable sensation in the epigastrium, irritability, thirst, tongue red in front or side with white sticky coating, saggy and rapid falls. The tongue coating is white because the pathogenic factor is on the exterior. So kahit heat yung pag nasa labas pa lang po ay white. So pag dry heat naman, dry heat is a type of wind heat which therefore manifests with simultaneous feeling of cold and fever. The clinical manifestation usually are fever, slight aversion to cold, shivers, slight sweating, dry skin, nose, mouth and throat, dry cough, sore throat, dry tongue with thin white coating, and floating rapid falls. The tongue coating is white because the pathogenic factor is on the exterior. So kahit heat siya, white yung nakita dahil nasa exterior pa lang. Thank you po.
Thank you very much, Ma'am Mildred. Let's now go to pulse diagnosis. Okay. Our topic for today is the liver pulse, left middle position. Okay. So this is the structure of the left middle pulse position. So if yung nasa right side would be the right lobe, the left side, the left lobe, the solar plexus, and the gallbladder sa ilalim. The left middle position corresponds to the liver and gallbladder. Okay, let's discuss floating. A floating quality po dito sa left middle position is quite common, and it indicates liver yang rising or liver qi rebelling horizontally. So this assumes that the pulse is floating only in this position and not floating in general, and that there are no symptoms or signs of exterior invasion of wind. So iba po ito doon sa wind invasion. If the pulse feels floating and wiry on the liver position, it indicates liver yang rising. If it is floating but weak and slightly hollow, this is stagnation of liver qi in the epigastrium and hypochondrium. Okay, so we're done with floating. Punta naman tayo sa deep. If the pulse on the liver position is deep and slippery, so slippery is phlegm. So there is phlegm affecting the liver and gallbladder. If it is deep, wiry, and slippery, it indicates gallbladder disease. So probably you will see it in gallstones, no? Deep, wiry, and slippery. If it is deep and weak, it is liver blood deficiency. Now let's talk about slippery. A slippery quality on the liver pulse indicates poor liver function due to affliction from phlegm. If the pulse is slippery on the proximal side of the pulse position, it indicates dampness in the gallbladder. So nasa proximal side po ng pulse, no? If it is slippery and wiry on the proximal side, it may indicate gallbladder stones. In this case, we will also look for small blood spots on the sclera of the eyes. Overflowing pulse. An overflowing quality on the liver position indicates liver yang rising or liver fire blazing. Wiry. If you have a wiry quality sa liver position, very common po ito because this indicates liver disharmonies. If it is wiry but also stagnant, so ibig sabihin without a wave but strong, it indicates repressed anger. Hindi nilalabas na galit. No? Wiry, stagnant. If both left and right middle positions are wiry, so stomach and liver, it indicates rebellious liver qi invading the stomach. So it is important na sabay natin ipupulse yung middle, left and right. Okay, this is a summary. Pag floating po, liver yang rising or liver qi rebelling horizontally. So it could floating weak and slightly hollow. Pag deep po yung liver pulse, may phlegm po in the liver and gallbladder. Gallbladder disease is deep, wiry, slippery. Pag liver blood deficiency, deep and weak. Okay, slippery. Liver affected by phlegm, dampness in the gallbladder. So that's slippery on the proximal side. Yung malapit sa atin, no? Gallbladder stones, slippery, wiry po sa proximal side. Overflowing, liver yang rising or liver fire blazing. Wiry, liver disharmony, repressed anger, wiry stagnant. Pag both middle positions are wiry, liver qi po is invading the stomach. Thank you very much. Any questions? Okay, mukhang wala. Let's now go to...
Yung sa ice doc na ano, yung red spot, sign po yun sa ano ng gallbladder, ano?
Yeah, liver, gallbladder. Oo.
Minsan po kasi may nakita akong ganun pasyente.
Mm.
Sabi, ano daw, mall sa mata.
Oo.
Matagal na daw sa mata niya yun, mall.
Kaya check mo
Nagkakaroon po
kaagad
ba ng
yung
mall yung mata?
compare mo yung pulse din. No, it's
Oo.
actually parang ano siya, yung blood vessel na medyo parang
Basta
congested.
pa,
Opo.
opo. Dahil responsible sa eye natin ay liver and gallbladder. Kaya
Yes.
doon po nag-reflect. Opo.
Okay, so Ma'am Mildred will again take care of liver blood stasis, another very common condition. Okay, Ma'am Mildred?
Liver blood stasis. Liver blood stasis, karaniwan na nakikita natin to sa may mga alta pressure eh. Etiology, emotional stress, stagnating liver qi, local blood stasis from knocks, falls, bleeding, qi stagnation, qi deficiency, heat, cold, impairing free flow of blood. Underlying accompanying pathology, stagnation of liver qi. Possible presenting condition, cardiovascular disease, hepatosplenomegaly. Tama ba, Doc? Hepatosplenomegaly, menstrual disorders, heterotopic pregnancy, postpartum disorders, sign and symptoms, fixed stabbing pain, superficial bruising, abdominal masses, dark purple clotted postpartum menstrual blood, painful irregular menstruation, infertility, soot-black complexion, rough, dry, lustreless skin, red speckles, purple macules, spider nib, ano to, Dok, pasahin? Pitates, purple nails,
Spider
purple
nevi, nevus yan, nevi. Spider
nevi,
oh.
spider nevi, purple nail, purple lips, vomiting blood, nosebleed. So, pag stasis talaga, yung mga purple po, yun ang tatandaan natin dyan. Basta't maraming purple, may stasis. Pulse, wiry po yan. Pag tinignan natin ang tongue, purple, especially side, possible purple spot. Treatment principle po, coarse liver, rectified qi and blood. So, yung acupuncture treatment po natin ay intestine 4, relieve pain, gallbladder 34, coarses liver, kasi partner organ po siya ng liver. Bladder 18 rectifies liver blood, baksyo yan ng liver. Spleen 10 rectifies blood. Spleen 8 harmonizes the womb. Kidney 14 moves the blood stasis. Spleen 4 opens chong vessels to invigorate blood. Bladder 60, so rectifies uterine blood stagnation. Liver 3, courses liver and rectifies qi and blood. Bladder 17 rectifies blood. Liver 6 regulates blood. Stomach 29 moves blood in stasis in lower burner. Liver 5 courses liver qi, regulates menstruation. So pipili po tayo ng mga mga points na yan. Tungkol puro sa blood dahil blood stasis. Thank you po.
Thank you very much, Ma'am Mildred. Punta naman tayo ngayon sa acupuncture patterns and practice. And we will start with angina pectoris. Okay. So, this is we call it angina for short. Okay, this is defined as tightness and suffocating pain in the chest and dyspnea. In mild cases, meron lang pong chest tightness with dyspnea. In severe cases, chest pain will penetrate to the back pain penetrates to the chest. And the dyspnea is accompanied by orthopnea. So ano ba yung orthopnea? Inability to breathe except in an upright position. Gusto ng pasyente nakaupo siya or nakatayo. Okay? Hindi siya pwedeng humiga. So, let's go to etiology and pathology. In angina pectoris, the main pathogenic agents are yin cold and turbid phlegm. Nako. Primary location of illness is the heart, but This can also involve the liver, spleen, and kidney. The pathology is that of chronic deficiency of chest yang complicated by opportunistic attack by pathogenic evils of yin and cold nature, which results in blockage and stagnation of chest yang and disharmony of the meridians. So the causes of the chronic deficiency of chest yang are often closely related sa body's constitution, old age, and aftermath of illnesses. Kaya yan naman sinasabi ko. Yung mga medyo mahina ang constitution, kailangan po nagpapa-check na, no? Nagpapa-treatment na acupuncture. So lalo na matatanda and also yung mga nagkasakit na before. Pero deadma pa rin, no? Sige, good luck. Okay, the precipitating agents may be exogenous cold. Okay, napansin mo, no, Ma'am Mildred, mahilig kasi sa malalamig mga taong. So, intemperate diet, excessive brooding, or habitual lack of physical activity. Mga tao kasi ngayon nakaupo na lang all the time. So, angina often results from attack by exogenous cold evil in a patient with chronic deficiency of heart qi or ineffective heart yang. Exogenous cold gels inside the chest, you see? And this will prevent chest yang from acting. So what happens is, nagkakaroon ng blockage yung heart vessels. So if there is blockage of heart vessels, nagkakaroon po ng sudden appearance of angina. Okay, itong mga emotions, no? Anxiety, brooding rage, and fright. Brooding rage kasi hindi mo nilalabas, no? Can impede the movement of heart and lung qi. So bawal talaga yan, no? This will lead to impaired circulation of blood. So this can lead to angina. When there is excessive brooding, spleen insufficiency, or qi stagnation, turbid phlegm can easily form. So, turbid phlegm, this will contribute po sa blockage ng chest yang. A diet rich in spices and fats or irregular satiation and hunger, if continued for a long time, this can injure po the spleen and the stomach. So, when that happens, this will disrupt digestion, transportation, and transformation. The essence from the foods and drinks cannot be efficiently extracted, and so it cannot support the generation of qi and blood. So dampness can accumulate, and pag may dampness, this can transform into phlegm. So yung dampness and phlegm can attack upward and invade the clear and hollow areas of the heart and the chest, so that qi movement is disrupted and the heart vessels are obstructed. Angina develops as a result. So pag nag-persist po for a long time ang turbid phlegm, the condition may become one of intermixing of phlegm and static blood. So in that case, mahirap na po i-treat. The illness becomes difficult to treat. Remember that pag may intermixing of phlegm and static blood, no? Super tagal. Kaya yung mga may phlegm, di ba, ang tagal mag-change ng dila. Kung po pwede nga isang taon, no? Once a week. Chronic fatigue, internal injury, or prolonged illness. So, yung mga nakaka-relate dyan. Meron tayong kilala na kaya hindi na, kaya yun. Chronic fatigue, internal injury, or prolonged illness, this will impair the functions of the spleen and stomach, so they become insufficient. So, qi and blood will lose the source of their generation, so magiging deficient na po sa visceral organs. Kung nagkaroon po ng significant blood loss or bleeding, so the blood vessels will become depleted of blood, and the heart will lose nourishment. So, you will have now heart qi deficiency. Heart qi deficiency will lead to heart yang deficiency. Deficiency of both yang and qi in the heart deprives the heart of its motive force. So, magkakaroon po ng failure of yang action. So pag hindi po gumagalaw ang yang, affected ang qi and blood circulation, and so magkakaroon ng angina. In the elderly, the body constitution po nagiging weak or nagkakaroon po ng deficiency of both heart yin and heart yang. After a long time, this may affect the kidney. Always remember na may kinalaman po ang kidney sa heart. So, ingatan ng heart. When kidney yang becomes deficient, no, it fails to invigorate the heart yang. Debility of heart yang will lead to failure to warm the blood vessels. So, pag kulang po sa warmth, hindi po magta-transport. So, this can lead to angina. At the same time, if we have kidney yin deficiency, this means failure of the water element to stimulate the wood element. Kulang kasi sa yin, no? And this cannot aid the heart. So what happens kung kulang tayo sa yin? The fire will then blaze in the heart and the liver. This we can not only scorch the fluids and transform them into phlegm, causing angina, pero it can also injure the yin blood and disrupt nourishment of the heart vessels. So with both deficiency of heart yin and poor nourishment of the heart vessels, the heart fire flares up, and pag nag-flare up po ang heart fire, this will injure kidney yin. Deficiency of heart and kidney yang permits yin cold and phlegm room to occupy the yang's place, causing obstruction now na heart vessels. So this further aggravates angina. In habitual physical inactivity, of course, yung qi movement po is impaired, and magkakaroon po ng impaired activity ng chest yang. This is the reason why obese persons beyond middle age are quite susceptible to angina. Yun. Let's go to clinical manifestation. Angina, kakaroon po tayo ng suffocating pain in the chest. No? The pain characteristically appears suddenly, but it may be intermittent, on and off. It is frequently accompanied by chest tightness, shortness of breath, palpitation of the heart. Yung heart pain po, nasa precordial area. Okay, sana wala pang nakakaranas yan dito, no? Sana naman suffocating, hindi ka makaano. And you feel more comfortable pag nakaupo, no? Hindi ka makahiga. Yun. It may be suffocating, vague, stabbing, colicky, or burning in quality. Sometimes yung pain nagre-radiate sa shoulders, the back, or the inner aspect of the left arm. So in mild cases, hindi masyadong significant yung heart pain, only chest tightness, pero parang nasusuffocate. There's palpitation and anxiety. Severe cases, take note, pag nagre-radiate na po sa back, no? And ang back pain pumupunta na sa chest, medyo kailangan na po talaga tayo magpa-check, no? It is intense and unrelenting. There may be accompanying sweating, no? Cold limbs, pallid complexion, cyanotic lips, dusky hands and feet. So tingnan na natin yung mga kamay natin kung nangingitim na. Pati mga paa natin, no? In the gravest cases, angina may develop suddenly in the morning and result in death by evening, or begin in the evening and result in death by morning. So I think this is what happened. Share ko lang po, meron akong kakilala, 40s pa lang siya. Tuwang-tuwa siya, lalaki, mahilig magluto, medyo healthy. So debut ng anak niya, 18, di ba? Babae. Nagluto siya the whole day, no? Nako, kinabukasan, kinatok nila sa pinto, wala nang sumasagot. Namatay siya sa birthday, sa 18th birthday, sa debut ng kanyang daughter.
Sobrang pagod niya, Doc. Affected talaga
Oo,
yung
sobrang
heart.
pagod kasi the whole day siya nagluto, no? Kaya wag na masyado magluto ng mga...
Tsaka mainit, Doc, di ba? O, adi lalong
Oh yes,
nag-overload.
mainit. Tapos medyo din siya, medyo healthy. Siyempre tuwang-tuwa, no? Nagkaroon ka ba naman ng So yun. Very sad, no? So pwede po ito mangyari to anyone. Kaya yung mga nagre-radiate, yung may chest pain, pumupunta na sa likod, nako. Sorry, may back pain ka, pumupunta na sa chest. Tapos hindi ka na makahiga ng straight. Kailangan mo ang taas ng unan. Medyo ano na po yan, magpatingin na po tayo, no? So,
May patient din po ako, Dok, na nag-cyanotic na talaga yung ano niya, yung lips, tapos yung kuko ko. Parang hinihintay na lang mamatay. Pero nung na-acupuncture po, nabuhay siya uli.
oo, syempre sa iba naman nag-acupuncture.
Nabuhay, Dok, uli. Talaga, nag-flow uli yung
Talagang
chi
healing
niya.
powers. Oo.
Okay siya hanggang ngayon, Dok.
Kaya po galingan na natin 'to, no? Sige. Okay, so may comments? Yung iba tahimik ka. Okay, dumadami na tayo po. Ay, nandiyan na si Ma'am Nitz. Nakapasok. Anyway.
Po, at
Okay,
saka si Sal Alvin, andyan na po.
sige, mamaya maggagawa ako ng announcement. Sige, yung pinaplano natin. Okay, next we go to long time no see. Buti na lang natapat ng Wednesday. May masteral kasi si Sir Alvin. Okay, maraming salamat po. Let's now proceed to signs and symptoms. Let's listen to Sir Alvin Palabay. Nasa Camarines Norte po ba kayo, sir? Sir Alvin? Nako, mukhang na-busy. Okay. Sir Alvin? Sige. Okay, ako na lang muna. So, ang topic natin is numbness of the tongue. Okay.
Hello, Doc.
Okay, ay salamat. Nakapasok din. Okay po, numbness of the tongue, Sir Alvin.
Pasensya na po, classmate, Doc. So, ngayon
Okay.
lang ulit.
Okay.
So, we're going to talk about numbness of the tongue.
Parang ang layo ni Sir Alvin. Sir Alvin, lapit ka po.
Kilala niyo naman si Sir Alvin kahit saan.
Nagta-travel yata si Sir.
Gusto ko baka ma-accident.
Sir, stop pa muna sa isang gilid.
Naririnig niyo po ba?
Narinig na po. Sige po.
Okay. So, numbness of the tongue. Kapag ang diagnosis natin, high blood deficiency, of course, pag may deficiency of blood, may numbness. So, numbness of the tongue, palpitation, dizziness, insomnia, dream, disturbed sleep, so memory, anxiety, may propensity to be startled, dark hair complexion, of course, deficiency, pale ang lips, pale din and thin ang tongue. At ang pulse niya ay choppy or fine. Okay? So, kapag ka naman ang numbness of the tongue is phlegm obstructing the heart, tapos merong numbness of the tongue, swollen tongue, swollen na yung tongue. So, may dizziness, kasi nga phlegm, feeling and pressure of the chest, sputum in the throat, numbness or tingling of the limbs, sticky tongue, cold feeling, and gluten pulse. Right? So, kapag ka-liver wound naman, ang pattern ng ay mainit yung baka. The tremors, may severe dizziness, may liver wound na, may tinnitus, may headache, may tick, convulsion, rigidity of the neck. Usually liver wound, tremor of limbs, wind, stiffness, so, to start coma in certain cases, cease moving or deviated ang tongue. Alright, so of course ang parts natin ay wiring sa pag-liver. Kapag ka-combination ng liver, wound, and phlegm, may numbness of the tongue, deviated na yung tongue, severe dizziness na siya, blood numbness, tremors, numbness of tingling of the limbs, tinnitus, nausea, sputum in the throat, the phlegm, a feeling of pressure of the chest, it or deviated and swallow on tongue. Right? So, wiry is literally na yung pag-liver and deficiency, kulang sa C, Ang flu, pwede rin may numbers sa taas, so ang appetite, okay, tiredness, mga sign ng blood, abdominal distension, to complexion list, to of course, ang tongue din sa empty ang fall. Okay, so kakalawang pasyente natin po, blood basis ang pattern na makikita natin. So, ang mga signs and symptoms, numbness of the tongue, dark complexion, blood basis kasi may headache, chest pain, mental restlessness, stamina, pain, dark nails, purple ang tongue, of course, and dry ang tongue. Alright, so thank you so much.
Thank you very much, Sir Alvin. Ingat kayo dyan. Baka naman ano. Maraming salamat po, Sir Alvin. Thank you. Next, punta na tayo sa walang katapusang asthma, but very interesting. Let's now go from Camarines Norte. Diretso naman tayo sa Urdaneta, Pangasinan, no? Let's listen to Sir Aldrin. Good afternoon, Sir Aldrin.
Good afternoon po, Doc Hector. Good afternoon po sa lahat. Okay, so proceed ulit tayo sa ating asthma. So interestingly, parang haba-haba yung discussion natin. So ngayon may mga i-discuss na tayong treatment principle, mga acupuncture points po. Okay. Okay, so base din po tayo, identification of pattern and treatment na. So the differentiation made in wheezing, nung tanda natin yung wheezing pattern sa chapter 47, between treatment, during attack, treatment, in between attacks is applicable to asthma. Okay, so yun, kung yung mga discuss nating points, or points sa treating ng wheezing, applicable po siya sa asthma. So the differentiation made in breathlessness between deficiency and excess condition is not applicable to asthma because this is always characterized by both a deficiency. So pag sabi natin asthma, yung deficiency ng lung at sa kidneys defensive system, and then may excess din, which pertain to the wind. So wind is excess pattern po yan. So the main patterns in allergic asthma are as follows. Okay? So during attacks, either wind cold o kaya ay wind heat. In between attacks naman, deficiency of lung and the kidneys defensive systems and wind in the lungs. Okay? So, pag sinabi natin, definitely meron na talagang deficiency ng lung at saka kidneys defensive chi. Tapos, meron ding presence ng lung. Meaning, hindi necessarily na yung wind, ganyan. Given na meron ng existing winds lang, pag natitigil yun, nagkukos po siya ng asthma. Okay? There are three approaches to the treatment for asthma as follows. So, during an actual attack, stimulate natin yung manifestation of yaw only. That is, expel, win, and restore the descending of lung qi. Okay? So, in a period of time, attacks are frequent. Treat primarily the manifestation. So, ano yung manifestation? The biyaw, i-expel natin si Win, and restore the descending of lung qi, and treat the Ben. That is tonify the lung and kidneys defensive qi system. Okay, kasi yun nga, yung na-discuss natin previously, ng treat, bakit nating treatment rin tumigil yung asthma kasi nga pattern siya. Share screen lang po ulit. Okay, so bear with me na lang. Medyo mahina yung signal. Okay, so sorry po. Okay, so yun po, nasa pangalawa na tayo, pag frequent yung attack. So, i-exhale pa rin natin si wind, then restore yung descending of lung qi, and then ititreat natin yung root. So, ang root kasi is, yun, meron ng lung at saka kidneys defensive qi system. So, need to tonify po yun. Okay? Yung pangatlo, in a period of time when attacks are infrequent, primarily the root. Okay, so ang root is the bend. We need to tonify the lung and kidneys defensive qi system, but as a secondary aim, also expel, win, and restore the descending of qi. Okay, so yun, active paano yung pagiging approach natin in treating asthma. In the treatment of asthma, especially acute cases, it is important also to calm the mind. Okay, bakit kailangan i-calm the mind? Kasi kapag trigger po yung parasympathetic nervous system natin kasi 'di ba meron yung bronchospasm na nangyayari during attacks. Okay? Meaning, we need calm the parasympathetic nervous system. Ganun kasi, yun po yung, hindi yan calm or nati-trigger po yun, yun po, siya po yung i-stimulate doon sa buko kaya nagkakaroon ng kapag triggers. So, meaning we need also to calm the mind. So, do 24 is recommended point. Okay? So, during attack, the treatments discussed below are not only to the actual acute attack, but also to a period of time when attacks are frequent. So, the two patterns of wind cold and wind heat may correspond to an asthma attack elicited by an actual invasion of wind with all its relevant symptoms, or a picture of symptoms and signs due to a pre-existing wind in the bronchi that is mimicking an invasion of wind. So, para ang gusto lang sabihin nito, so definitely kapag meron ng asthma, di ba meron ng pre-existing wind na namamalagi doon sa bronchi. Meaning, anytime kapag trigger, magre-result doon sa bronchospasm or the trigger na po yung asthma, right? So, there are instances na kapag merong invasion ng wind, yun po yung magiging trigger. Okay? So, regardless kung ano po yun, ang magiging treatment principle is as discussed. Okay? So, yun.
So, continuation po nung asthma. During attacks, the treatment discussed below apply not only to the actual acute attack, but also to a period of time when attacks are frequent. The two patterns of wind cold and wind heat may correspond to an asthma attack elicited by an actual invasion of wind with all its relevant symptoms, or to a picture of symptoms and signs due to pre-existing wind in the bronchi that is mimicking an invasion of wind. If there were an actual invasion of wind, there would be aversion to cold, shivering, and possible fever. The pulse would be floating. The pattern described below, however, presume an acute attack of asthma, manifesting with certain symptoms of wind, but without an actual invasion of external wind. If there is not an actual invasion of external wind, the treatment principle is to release the exterior. A herb that release the exterior also expel wind from the lungs in allergic asthma. The patterns occurring during attack discussed will be: pag wind cold po, wala siyang sweating. May wind cold din na with sweating or wind heat. So, dalawang klase po ano. During attack, wind cold without sweating. Ito pang nangyayari. So, sudden wheezing and breathlessness. Nahirapan siyang huminga. No sweating. Siyang sweating. Maputla po ang kanyang mukha. Pakiramdam niya na malamig tapos hatching siya ng hatching. Yan. May ubo pero hindi siya nauuhaw dahil cold nga. Attack elicited by cold weather. So pag mas malamig, a-attack yung asthma. Makakaramdam din po siya ng stiffness of shoulder and neck. So pag hinawakan po natin yung kanyang pulse ay tight. So ang treatment principle po doon ay tanggalin natin yung exterior na pumasok na hangin. Expel wind cold. Tapos restore the descending of lung qi to calm the mind. So yung points po natin gagamitin ay ang Ding Chuan. Dito po yan sa may likod natin sa may leeg. So bladder 12, bladder 13, kasi ito nag-exteriorize ng wind. Bladder 13, vacuum of lungs. Ren 22, lung 7, lung 6, heart 7, Ren 15, GV 20, gallbladder 21. So ang gagamitin po natin ay reducing method dahil excess condition po ito ano. Tapos cupping pwede rin po bladder 12 and 13 kasi wind. So pag nag-cupping tayo, exteriorize niya yung wind. So extra point po yung Ding Chuan, stop po ng acute asthma. Pag bladder 12 po, expel wind. Special point for wind din yan eh. Bladder 13 and 22 and lung 7. So ito po yung nagre-restore sa function ng lung, descending function of lung qi. Pag lung 6 po, accumulation point, stop acute asthma. Heart 7 and Ren 15 calms the mind kasi heart point po yan. Heart 7 also make qi descend and Ren 15 relieve fullness in the chest. Gallbladder 20 po and gallbladder 21. So i-relax niya yung neck and shoulder. It is important to drop the shoulder girdle and help breathing. Gallbladder 21 also make qi descend. So yun po yung mga gagamitin natin na points. Thank you po.
Thank you very much, Ma'am Mildred. Maraming salamat.